I'm Dr. Kenneth Palestrant. I'm the medical director and the CEO of Pinnacle Wellness Group. Pinnacle Wellness Group is a group of 4 physicians and 2 nurse practitioners here in central Port St. Lucie, right near US 1 in Wingate. We primarily focus on MAT, medication-assisted treatment, focusing on treatment for opiate use disorder, people who are addicted to opiates, and alcohol. Opiates affect the brain at a neurochemical level. So what ends up happening is people who take opiates, whether it's prescribed opiates or illicit opiates, whatever the case may be, initially they will get euphoria. They'll get high. They'll feel good taking this medication. In the case of somebody who has pain, let's say post-surgically or something like that, it makes their pain go away. It makes them feel good. Eventually it wears off and the cycle begins again. They take more medication, the pain gets controlled. Eventually, after a period of time, and in some cases even after a week to 2 weeks of taking these medications, whether it's heroin that's off the street or prescription narcotic medication, opiate, what ends up happening is they no longer are wanting to go back to use these opiates for the euphoria. It's primarily just to feel halfway normal again. Because what ends up happening is over a period of time, the neurochemicals are feel-good chemicals, I guess you could say, that exist in our brain, are depleted by the opiates. So what ends up happening is this tremendous craving that they get for these opiates is just to basically replenish some of those brain chemicals to make themselves feel good again, not even to get high or alleviate the pain. Well, there's a lot of different signs and symptoms, vital signs, eye, pupil size, things like that, agitation, sweatiness, all that kind of things. There's kind of 2 different extremes. There's the people who are on opiates, who are, I guess you could say, under the influence of them, and their gait is abnormal. They have a hard time maybe with their words, their train of thought, those kind of things. Those are the people we see are high. And then the other end of the spectrum is the people who are within withdrawal, and they are agitated, they're sweaty, they're nervous, they're nauseated, and then there's a whole slew of symptoms that go on, beyond that. The interesting thing, though, is how many people are in society today who are under the influence of opiates, of narcotics, and function. They're driving around in cars, they're working, they're functioning in society. I guess we're just in a lot of ways, a substance abusive type of society, because everybody seems to be on something. The studies have shown that some people have a higher propensity for more of an addictive type behavior, I guess you could say. And sometimes within a week, 2 weeks of being on narcotic pain relievers, opiates, that they can actually develop an addiction to them. But the mechanism is that the neurochemicals that normally exist in the brain get depleted with the continued use of the opiates. And what ends up happening is when the opiate wears off, those brain chemicals that have been depleted, they're no longer available. So people come down after whatever, if it's a short-term opiate, 4 to 6 hours, let's say, after they've taken their last dose, and henceforth they start having this craving, this need to take more medication. And it becomes a kind of a vicious cycle, because what ends up happening is they end up taking more and more of the same drug, higher doses, to achieve the same effect. It's early on, it's euphoric, they feel good near the when they're kind of deep into their addiction. It's just to kind of feel normal again. That's a very good question. So, yeah, prescription opiate abuse is one of probably one of the major drivers of opiate use disorder in our society. Years ago, when I was in residency, I've been practicing medicine for almost 30 years now. The only time we used long-acting opiates was for people who had chronic malignant pain. Malignant being pain that just wouldn't go away, whether they were cancer patients or patients with bad surgical outcomes and things like that, but they were very few and far between. And then the big pharmaceutical companies started coming out with some of these time-release oxycodone formulations with the intent that it was to be given once every 12 hours. It was very little chance of abuse and all this other stuff. And unfortunately now we realize, especially with the opiate settlements that these drug companies have entered into, that a lot of that was sold to physicians and sold to patients in particular through advertising, all these other means. Drug reps coming in and purporting to the family doctors about the safety of these medications. So what ended up happening was it kind of exploded, and more physicians were writing for more and more pain relievers, and then it morphed into pain clinics with a lot of illicit operators, business people, and physicians themselves getting involved with a lot of illicit activity. And it got worse and worse and worse. And then what ended up happening was the authorities, the governmental authorities, regulatory authorities, came to the realization that this thing was out of control. So started dialing back the amount of medications that were being prescribed out there on the street. They cracked down, rightfully so, on some of these pain clinics. Physicians went to jail, pain clinic owners went to jail. So what ended up happening was suddenly the amount of prescription opiates were drastically curtailed. The problem was the opiate epidemic was already out there. There was more and more people who were already addicted. So once you cut off the supply, where do they end up going? Heroin filled the void. And then the big spike in overdose deaths really occurred when the heroin started being adulterated with fentanyl. And now we're seeing not just heroin, but we're seeing all kinds of illicit pills out there on the street mixed with fentanyl, which is 1,000 times more powerful and more dangerous. Henceforth, we're seeing this just tremendous upsurge in overdose deaths. That's a tough question to ask. I mean, I've dealt with a lot of families of opiate abusers, and they keep trying, they keep trying, they keep trying. There's only so much that a family member can do, unfortunately. There's so much relapse in this area here that these poor parents and loved ones, they continue to kind of go on that same merry-go-round over and over again. Unfortunately, what ends up happening is sometimes it stops, and it stops when that person dies. And there's numerous stories out there where you have parents, loved ones who've lost children and husbands and wives and parents and grandparents to opiate overdoses. So there's try to seek out support in the community, whatever community assets are available, because there are people out there who do care. There are people out there who are trying to reverse this epidemic of overdose deaths within our community. So there are community resources out there. depend on them as much as you can. Just keep trying, because unfortunately we have to understand that people who are addicted to substances, whether it's opiate or alcohol or whatever the case may be, they're always going to be addicts. They're always going to be. It's like the alcoholics. They're lifelong alcoholics. They always talk about how much time of sobriety they have and how much time they've been off clean. It's a totally different lifestyle. It's not like, well, that was my past, and something I can just kind of forget about. I think it's inherent and upfront with them all the time. So keep trying. Don't give up on your loved ones. Realize that it's a disease process. It's not just something that they really just want to do. Unfortunately, it may have been that at the very beginning. So try to utilize whatever resources are available in your community, and keep hoping and praying.
Thank you.